Hello, everybody, and welcome to today's webinar, where we'll be discussing 5 ways to differentiate your practice in 2020. I'm going to give it a few more minutes to see if other folks are joining. In the meantime, go ahead and introduce yourself in the comment box if you want to tell us where you're from, where you work, maybe what you're hoping to get out of this webinar. Would love to hear from you. Okay, 2 minutes passed. Just want to see if anybody else is going to join. I'll give it one more minute. Okay, so I'm going to get started. Thanks again to everybody for joining us for today's webinar. Well, we'll be discussing 5 different ways to differentiate your practice in the new year. Hope everybody can hear me okay. If you have any trouble, just let us know in the chat box. And we're going to get started. So to introduce myself, my name is Erica Abraham. I'm the Publisher Operations Manager over at Doctor.com. We'll talk a little bit more about Doctor in a second, but more about me. I've been here for about 4 years. I have the privilege of working with some of our different publishers, the different places that list provider content online. So Health Grades Vitals, Wellness.com, some of our partners that I get to work with every day. And today I'm honored to be joined by Lauren Spethman, an account executive at Klara.
Hi, everyone. Like Erica said, I'm Lauren Spethman from Klara. I've been with the company since fairly early on for around 4 years now, and I work with practice leaders, providers, owners, practice managers, and really helping them understand how communication fits into the patient experience and their growth strategy for their practice, and what are some ways that they can leverage technology to better take advantage of sort of what's happening with patient experience as a whole.
Awesome. Okay, great. So just a little bit more about Doctor.com. We were founded in 2012 with the mission of helping healthcare organizations deliver a better customer experience at every step of the digital patient journey. So our network reaches about 100 million different patients searching for care every month. And we power more than 30,000 different healthcare organizations through our platform. And part of my work involves the direct partnerships and the proprietary API integrations that we have with these different healthcare and consumer websites. And I'm really excited to help you understand how you can utilize that network and other different strategies to differentiate your practice in the new year. Lawrence, would you like to tell us a little bit about Klara?
Sure. So the goal of Klara our mission really is to transform communication in healthcare so all patients can receive great care. Klara is a secure communication platform that makes it really easy for your team to communicate with patients and with each other. There are really 3 objectives. The first one is to automate day-to-day tasks like follow-ups and reminders so your staff can focus on giving patients the exceptional experience they deserve, as opposed to focusing on things like phone tag, listening to voicemails, or doing follow-up calls. And then the second objective is patient experience. So giving patients a really outstanding experience that sets you apart as a great provider and a great business in the marketplace, so that patients go to you and not to other practices. And then the last thing really is Klara wants to help you improve your bottom line. So reduce your overhead costs and help you grow your revenue so that physicians can take more money home at the end of the day, or you can invest more into practice growth activities. So from here, why are we here? Why are we talking? Really, what does the modern patient need? Technology hasn't really changed very much in practices, except for maybe the last 5 years. And if we think about consumers, and patients are consumers, whether we like it or not, what do they pay attention to? People are using the internet nearly twice as much as a referral than as a referral from someone that they know. So this is something that we see across categories, right? Banking, restaurants, etc. So people consult 2 to 3 different sources before choosing a doctor. They rely on the internet twice as much as they do on word of mouth. And even after they've been referred to somebody, 88% of patients will actually read those reviews. So patients want to confirm what they've heard from their friends with their own research, and they'll consult multiple sites in the process of doing that. Patients will even switch providers based on convenience and access factors alone, and we'll get into that a little bit later. So to that end, I'd like to kick things off with a little poll question. Everyone in the room, so to speak. Have you Googled yourself in the past year? And I think we'll open the polls now. So let's see the numbers coming in. Give everybody some more time to answer. So there's a tab in the top right corner next to the chat box where you can put in your answer for polls. Okay, it looks like some people have, some people haven't, at least in the chat. Let's give it another minute for everyone to reply. Okay, sounds like most people here have definitely Googled themselves or Googled their practice in the last year. So it sounds like everybody's pretty on top of it. If you haven't done it recently, I highly recommend that you Google your name or your practice's name after this call and see what comes up. Given that most patients rely on the internet to find new healthcare providers, if you're not showing up in Google results or you have a poor presence there, they're going to move on and find another doctor. So in this webinar, we're going to cover everything you need to know to establish that stellar online presence and reputation. And we're also going to talk about a couple of ways that you can modernize your patient journey and patient experience to engage your patients and staff through more convenient and streamlined communication. So with that, I'll hand the mic over to Erica.
Awesome. Thank you. So to get started today, we're going to talk a little bit about how you can get your online presence in tip-top shape. So we know that patients are looking for information online every day. And nowadays, having technology at the fingertips of everybody that has either a mobile device, a desktop computer, a laptop, an iPad, etc. We all know these different kinds of devices are everywhere. Patients have become independent learners who want to do their own research. And for many years, A lot of different people, a lot of our clients thought that their website was considered the digital front door to their business because it was where people would start looking for information about a provider or a business, maybe from a business card or a billboard or the yellow pages, like a print resource, something like that. Our clients, doctors, and business owners across the country invested a lot of time and energy and money into creating great looking, user-friendly websites. And while that, of course, is super important, right? You want to have a mobile optimized website today. You want to make sure that people can easily find your website and navigate through it. There's a different approach that I want to emphasize in today's session. And the idea here is to really consider your whole presence online and more holistically than just your website. And what I mean by that is there's so many different resources online to find yourself. For providers, they're able to see health grades, wellness, these different directories now. And patients have really grown tired of finding inconsistent or outdated info about their provider. As you can see up here, it's super important. About 56% of people will choose a provider with a stronger online presence, right? They're going to move on if they don't like what they see or if it's unclear. And with all things being equal, they want to choose a provider with a stronger, more consistent online presence. What I mean by that is they don't have to search around site to site, call a few different numbers and see which one works, right? All of the information is consistent. You want to make sure that the same idea is true for the rest of your content, like your website, your procedures. If your practice has shifted its focus from, let's say, cosmetic to implant dentistry, you want to make sure that that's reflected across all of these different sites. If you did a special 6 months ago that's no longer active, save yourself the trouble by removing that from websites so it's not something that you have to navigate with those patients, right? What we found here is that patients are going to search around and they want to make sure that they're liking what they see across all of the different directories where you're listed. And we have a saying here at Doctor that Google's the airport, it's not the destination. What I mean by that is patients will go where their search takes them, right? They'll start on Google. And a lot of us have heard, I found you on Google, I just did a search online. But Google actually isn't a directory, and it's not something where they're going to conduct most of their journey. It's a tool they use to get to a lot of these different directories directly. And they're going to probably end up on these sites that land on the first page of search, the health grades, the vitals, the WebMDs. They're going to check your ratings. They're going to read reviews before making decisions. And they're going to click through a few of these different sites probably to make a comparison. Obviously, what I'm getting to here is this idea that third-party sites have taken traffic away from your website. So if you've invested all of your time in just honing in on that website and making it look perfect, you're forgetting about the rest of the landscape. And it's critical to be present wherever patients are going to be searching for care. And as I showed you before, millions of patients every month are going to these other sites. You want to make sure you have all of your bases covered, and you want to make sure that your listings are accurate across all of these different sites. And the idea here, of course, is consistency as well. So if people are seeing great reviews on one site and another, they're going to trust you a little bit less because they're unsure about where to go. How you can take advantage of this and how you can take control of it, rather, is to become a verified owner of all your profiles. It might seem overwhelming, but you want to claim these listings. All of the different directories have a process to do that, and build out compelling profiles, following their rules, uploading your headshots, and taking care of each of these directories. You might also be wondering how you can build up your reputation, right? Because it's a little bit more than just having your information look correct. Patient-generated reviews are going to be the next piece of the puzzle. So what I want to talk a little bit about here is how familiar patients and consumers became with reviews across all of the different segments. I'm never going to order from a restaurant on Seamless if I don't check the reviews. Same thing on Amazon, same thing on Airbnb for sure. And if I'm seeing a provider, or if I'm recommending that a family or a friend goes to see a cardiologist, for example, I'm surely going to be checking those reviews. And patients want to hear from their peers. Sometimes we get this idea that I was referred by my primary care provider, so I'm just gonna go right to that person. Today's consumer is going to use that same logic and search around. They're not just going to trust the business card that was handed to them in their primary care. They're going to search for that person, and they're going to read a few of the different directories. So they want to understand what they can expect when they go to see a new healthcare provider. And patients are reading reviews. This isn't something that's just content out there that goes nowhere. About 80% of patients are going to read reviews before they choose a healthcare provider. So that's a whole lot. That's majority of these patients and these people that are searching. They're putting a lot of these stock into these online reviews too. And you might be thinking that I've had a couple of these different sites. I have a Google review from, I had an amazing review last year when I saw this patient. The idea here is to make sure that they're constantly updated. You want to make sure that you're often refreshing this content, that patients are easily understanding that the same person that saw you 6 months ago and yesterday are having the same experience. Nearly 90% of patients will change their mind about a provider rated under 3 stars online. So what I want to talk about here is how you can protect your online reputation and make sure that it reflects your practice, right? I'm talking about getting new reviews, but what can I do about negative reviews out there that might already exist? We say here that the best defense is a good offense. So that continual idea of collecting reviews will help offset one negative review. And I think all of us have been there as patients and as consumers, that one negative experience for one person might be due to appointment mishaps or billing or insurance, and something that I can control. Frankly, negative reviews kind of fill in the picture. So having 100 5-star reviews and one negative really just creates a realistic experience. So what you want to do is just constantly build up that stockpile of great patient reviews so that your content and your profiles stay fresh. And it'll also help strengthen your reputation, so it's even more impervious to a rare negative that might come through. How we do this at Doctor.com, I'm going to talk a little bit about our Review Hub, which is a device that is able to publish reviews onto the top healthcare sites like Health Grades and Vitals and Wellness without the patient having to write that review over and over again. So it saves everybody a lot of time and energy. The way we do this is through a laptop that sits in your office and captures patient reviews right at the point of care. So the patient's able to quickly fill out this short survey, and we're able to submit it to those different healthcare directories. You should see a little pop-up right now that you can click on to request more information about the Review Hub if you're interested. And we also just launched a new all-digital version. So if somebody's really running out the door and they don't have those 2 minutes, you can send them a quick message. Super brand new, really excited about that launch here at Doctor.com. And really quick way to just gather reviews beyond the physical device that we've had for years. Another piece of our puzzle here is now that the patients have found you, right? They know where your office is located. They've read the reviews. They want to come see you. How can they quickly and easily request an appointment? How simple is that process for them? I'm going to walk you through that last step of the finish line. And the idea here is that patients are going to expect convenience in everything they do, right? They've shopped around. They've already done the legwork to find you. Ideally, that was as easy as possible. But let's not make it more inconvenient for them to get into the office, to request that visit. Let's say I'm browsing on my phone. It's midnight. I know I need to schedule that appointment. Do I want to call and leave a voicemail? Or do I want to just quickly say the day and time specifically that I want to come in and have you get back to me? It makes it a much better patient experience if they're quickly able to take care of this online. And we've seen that about 60% of patients prefer to schedule appointments through digital means. And that's up about 45% from last year. So this is increasing year over year. And what we found is that online scheduling and online appointment requests are really great, an important way for your patients and to help you get more reviews in the end, because they've had a positive experience the whole way through. And again, with these, this idea of across different industries isn't at all healthcare. I think it's a lot more common, like Airbnb, OpenTable. People are really familiar with booking online, right? You're on the go. You're easily able to do this right at your fingertips. And online booking makes it even more simple. You don't even have to pick up the phone, open your email. It's all right within that one app and all within that one different healthcare site. A lot of people think this might be popular just among a younger generation, but the preference for online scheduling, I just want to touch on real quick, is true across all generations. About 40% of people over 60 prefer digital scheduling over a phone call. Everybody, no matter how old you are, has limited time in the day, and they want to keep things as convenient as possible. So it's something that everybody is trying to do, and something that we see no matter what specialty you're in, no matter who's booking the appointment. Because keep in mind, sometimes a young adult is booking an appointment for their parent, right? Just because the patient at the end of the day is going to be somebody that's more senior doesn't mean that they're the one necessarily booking for themselves. Obviously, the same logic applies for a pediatric appointment, right? So online booking is something that benefits everybody, for both the patient and for your practice. So a lot of the different clients that I speak to want to be able to do this as easy as possible, right? They're busy. Picking up the phone for them to answer those inbounds takes about like 5 or 10 minutes per call. We can really streamline that with online appointment requests. What I mean by that is you already have an email message that says the day, the time, the insurance, and when this person would like to come in. So you're easily able to click confirm. You have everything you need. We don't automatically add anything into your schedule, but you're quickly able to just get that taken care of. By facilitating this last mile, you're capturing more patient leads, which goes a long way in growing your practice with new patients, and it makes it even easier for your staff. So win-win. On that note, I'm going to pass it back to Lorenz to dive deeper into patient communications and other ways that you can make it easier for both your staff and the patient.
Thanks, Erica. This is awesome. I think there are so many parallels between what you were talking about and what I'm going to touch on briefly. So to start off, I'd just love to start with a little polling question. And we've talked a lot about reviews. We've heard a lot about how important it is to have positive reviews on your website. One thing that we did at Klara was we looked a little bit into what is the main driver of negative patient reviews. So I would love to shoot everybody over to the polling section and just put in what you think, whether you think the #1 driver of negative reviews is quality of care, longer wait times, maybe billing, or communication with the practice. Let's see here what people are saying. I'll wait for the votes to come in here for a little bit. I love asking this for clients in my presentations as well, and the answer is always really, really interesting. So it seems like most people have put in their vote. Let's see what people are saying in the chat. Yeah, so it seems like there's a consensus. 50% of people are saying communication in the practice is likely the #1 driver of negative patient reviews. Some people say billing, that's one I get a lot, and then wait times. And without further ado, I'm going to give you the answer. We found that the #1 driver of negative patient reviews is actually communication. In reality, only 4% of patient complaints are about the clinical care itself. Let's zoom out and think about why that is. The industry is making a lot of investments into clinical outcomes to make them better and better. Think about drug development, think about all the continuing education that physicians and clinicians do. A lot of new research being done, peer review studies. So it's not exactly surprising that patients are generally satisfied with the clinical care themselves. I think, wait times in waiting rooms goes towards patient experience in general, and then billing is somewhere in there as well. But by and large, the most complaints that you see in reviews are relating to communication. That can be anything from, there not being proper follow-up, patients feeling like they're waiting on hold, making a ton of calls, feeling like their calls are never returned. So those are all things that run the gamut of these things that pop up in patient reviews. And so if we look at why that is, poor communication really starts with the phone, right? A lot of the time we hear patients are waiting on hold, there's endless phone tag, maybe there are really long response times, patients feel like they're not being followed up with. Sometimes even patients slip through the cracks. I feel like we've probably all experienced this. A patient calls the practice, somebody writes down a note saying this patient needs to be called back, there's maybe a change in shift, and then all of a sudden somebody forgets and that patient needs to call again the next day. It's really normal, right? It could be that you have this issue. It could be that you don't have this issue. Maybe you're just a really busy practice leader or owner and you have a lot of other things to think about, so it just hasn't come up. That's exactly why we're talking about it. And one of the things that I recommend to the practices that I talk to is, have you tried anonymously calling your practice for a scheduling matter or maybe for a follow-up question, especially during peak time? So for example, Monday mornings or right on Friday before the weekend, and have you tried to look at it from the patient's experience? A lot of the practices that we work with originally figured out that it was a problem for them by doing this. And so the good news is for a lot of these issues, you can solve them, right? So responding to patients faster, not keeping patients on hold, eliminating phone tag, and connecting with patients between visits are all things that can be done. All of this basically helps you create a better experience for patients, get more positive reviews, and differentiate your practice. And we'll talk a little bit about how to do that. So convenience is king. When you're thinking about the type of solution that will work for you, I would urge you to consider, what have you done in the past that's worked really well, and what have you done in the past that maybe hasn't worked so well? Some of the things that I hear often that practices do is they say, we're going to add more staff, we're going to hire a call center, we're going to add more phone lines, we're going to provide more communication options, we're going to hire an answering service to handle the overflow of phone calls. And now, while I think on one hand that's pretty normal, it's a really, those are all standard solutions, try to think a little bit outside of the box, because at the end of the day, patients still want to talk to you. That much hasn't changed. Patients still want to talk to you, but the way that they want to talk to you, the way that they want to communicate with the practice, that's changed. And I think a lot of the things that Erica touched on are very, very much true for communication, not only with respect to scheduling, but it extends into asking clinical questions, getting their pre-procedure instructions, maybe post-procedure instructions. If you have a really high barrier for a patient to get through to the practice in order to ask, this is an OB use case. We recently saw a patient asking, hey, I'm drinking turmeric tea. A friend of mine said that this interacts with my birth control, and is it okay for me to drink this turmeric tea? And that's a question that maybe seems arbitrary, but that patient had a better way of asking it because they could do it through digital means. And so if we think about convenience overall, we need to think about what are the downstream effects of having communication that's inefficient. The phone is unfortunately not the best option for communication, primarily because it takes a lot of time to resolve encounters, and it also takes a lot of your team's time to respond to patients, right? So we see practices wasting up to 3 hours per staff member per day just on phone tag, right? Patient calls with a question, the question can't be answered immediately, so a note is taken, then somebody runs over to the doctor, and then finally, once the question is answered, a front desk member picks up the phone and starts calling the patient. Issue with that is that patients are then, maybe they've gone back to work, right? Maybe they've, gone somewhere else. Maybe they have an appointment, right? So they're not going to answer the call. So you leave a voicemail and then the patient calls you back, right? So all this phone tag creates an immense amount of work on the back end for your team to take care of. So keep in mind how much work your staff is doing in addition to everything else that they have to worry about, right? That's not actual clinical care. So let's talk a little bit about the convenience of texting. How do we meet patients where they are? Patients want to ask questions and communicate with their care team the same way they do throughout their personal and business life. That's through mobile devices. 80% of people worldwide want to text with their doctor. Texting has become the accepted way for healthcare consumers to communicate not only with their friends, but with their healthcare providers too. I think a really good example of this is when I'm in calls with physicians. A lot of the time they'll say, my practice manager really doesn't want me to do this, but I actually give patients my cell phone number so that they can text me if there's anything urgent. I've heard several times that there are nurses who give out their cell phone numbers to to patients on physicians' behalf to answer those questions. So this behavior of texting with healthcare providers already exists. And what's really important to recognize is it's a consumer preference. And so as practice leaders, try thinking about what are ways that you can offer that option or integrate that into your workflow in a way that makes it also more convenient to your teams to do that, right? With text, one of the things that's really great is it's an easier to use interface. Nearly 95% of Americans own a mobile phone, and 90% read text messages within the first 3 minutes of receiving them. I don't know what all of y'all's email inboxes look like, but I can guarantee you things get lost in email way more often, right? And so with texting, you have the benefit of everything being asynchronous. Everything is in one place. If you're like me, I need to make time in my calendar to leave my open space office so I can have private conversations about my medical needs because I want privacy. But I can text from my desk. I think that's one of the main differences between phone communication and text communication. You can communicate confidentially about patients' needs without them needing to go somewhere. And if you offer a texting option to your patients, it'll make a huge difference because you can add a personal touch that you wouldn't be able to over the phone. For example, you can easily reach out with a text to follow up with a patient and see how they're recovering post-surgery, or maybe they had a filler injection, maybe you adjusted their medication. It's so easy to just shoot off a text and check in with them, as opposed to having a nurse, for example, call a patient 4 or 5 times and try and reach them and leave a voicemail. Just by being responsive, you're going to be showing patients that you care. And this is one thing that goes towards patient experience. Manage expectations right up front. Tell them when they can expect an answer. And when you text them, even if it sort of seems random, right? If you check in with them after they've had a procedure, or like I said, after you've adjusted medication, they're going to feel like you're taking care of them. And in that sense, technology really lets you deliver a higher level of service with less work invested, especially if you're looking at the right tools. So patients often feel like they're being a burden by calling and asking a question. But if you give them a way of asking those questions and you can handle their requests in a way that takes you less time, then you're in business, right? Then you have the right solution in place. So to summarize here, choose a solution that's focused on providing convenient communication to your patients, and think about, what are tools that patients would actually use. And that's why, like, when you're evaluating technology tools, what's so important is that you see the patient experience. If you can, try and get whoever you're evaluating to show you what is it like to use this as a patient. And then ask yourself, is that something that you would use? Is that something that your friend would use? And if the answer to that is yes, then there's a really high likelihood that it'll actually be successful in your practice. Where we come in here from the Klara side is our adoption rate. So we've done a lot of research over time to understand how do we get patients to use a product, even though they might not be using it every day. And for us, a couple of years ago, we still used to do notifications to patients through email. We offered the option for both email and text. And what was interesting was we looked at our customers that had the highest patient read rates and the highest patient adoption rates in the 80s and the 90%. And there, most of their patients were actually using text notifications. And so the way that we've been able to expand this 85% patient adoption rate to an average across our hundreds of customers and millions of patients is by removing the barriers for patients to use the product. And that's really not requiring patients to download an app. Patients don't need a username or a password to remember, and they don't need to register for anything. So it just works with their cell phone number and their date of birth, and everybody can remember their date of birth. So it's very, very easy. Don't even get me started on patient portals and their adoption rates. I think those speak for themselves. And the main reason for this is really because with convenience of Klara and convenience of communication, you have something that patients will actually use, and then by extension that the practice will actually use and benefit from. No matter what solution you choose to provide more convenient communication for your patients, you'll want to make sure that their mission is to solve that challenge specifically. I'm sure a lot of people in the room have appointment reminder solutions or check-in solutions, and those are all really, really great. But fundamentally, as a practice leader, what you're going to need to ask yourself is, if you have a communication challenge, if you have issues with phone tag, maybe even internal communication, patients not being followed up with, a ton of voicemails, are you going to invest in an add-on feature for your check-in solution that sort of does patient communication, or are you going to look for something that's really more holistic to actually solve your problem? And if you want to dive in, more deeply into this topic and how Klara can help, you should be seeing a pop-up right now that you can click to learn a little bit more. Okay. On one hand, I'm sure some of you are thinking, this is really great. I'm game for making communication more convenient for patients, but what about my team? I can't make things harder for them than they already are. And I am 100% with you. We work a lot with tons of different medical practices, large, small. And I think one of the things that I consistently hear is we don't want teams. Oh, there's the pop-up. So if you want to learn more about how Klara can help your practice, feel free to click here. Back to this topic of tools, right? If you get a tool that's great for your patients, that's awesome. But if it creates more work for your staff, then that's annoying and you don't want to do it, right? And as somebody who works a lot with front desk teams, for example, I can tell you that this is something I hear a lot. So don't overlook the importance of effective internal communication among your team members. And remember that team communication goes hand in hand with patient communication, because if you have an isolated system for communicating with your patients and your team can't talk with each other about those patient cases and their questions, it's going to make everything infinitely harder. So when your care teams aren't communicating effectively, operations aren't running smoothly, and then you can text your patients as fast as you want, but if the actual answers to those questions aren't being processed throughout your practice, then the solution isn't helping you. So just something to keep in mind, that effective communication, and especially effective communication technology, can and should meet both criteria. It should be easy for your team, and it should be easy for your patients. And in that sense, I also think that efficiency really matters as a differentiator. I love this quote because it speaks to a lot of things that I talk to my clients about. And it's, if you want to improve patient relationships, build sustainable models to support frontline staff and free up their time. Healthcare is a people business. There's no substitute for that. Little anecdote here. I think that being a front desk person is really hard, and I actually think it's one of the hardest jobs in the office. Answering the phones, checking in patients. Just today, I had a call with a client who said they get over 300 calls a day. They get a ton of voicemails. They are super overloaded. They have really high staff turnover because the job is so stressful in terms of just answering the phones and following up with patients. The doctor actually came to the practice manager and said, if I get another complaint from patients who aren't able to get through our phone lines, I don't know what I'm gonna do. And so this is really a reality. And if you think about competition, right? So we're talking about differentiating your practice. If a patient is having trouble getting in touch with your practice, right, they're going to go somewhere else. At the same time, you want to be smarter than your competition, right? This practice that I was talking to said they're considering hiring additional staff. And I think that's what most people would do. Most people would just throw bodies at the problem, spending tons of money on additional staff, maybe more phone lines, a call center. But really, efficiency matters as a differentiator because it gives you more time to spend with patients. So one side is the patient experience in terms of communication, but then think about, just imagine if you had a front desk that wasn't constantly answering the phone anymore, but could actually spend time on marketing, or bringing in more patients, working on referrals, making sure that patients, when they're in the office, they feel really great and they have a good experience, reminding them to leave a review. So those are all things that you can then invest time in when you're no longer so busy playing catch up with phone tag and email. So ultimately, this becomes about empowering your team to make communication really, really simple. The first thing you want to think about is, whether your practice could be more efficient. You might be thinking, we have our EMR and we have our patient pad where we take down notes. So what else are we supposed to be doing? As practice leaders, maybe after this, go back to your practice and think about, okay, what are the conversations your practice is having with each other today? Most everything you discuss, other than where you go to lunch, is about a patient. So take a second to think about where are those conversations happening, and are there ways that we can maybe do that better or make that faster? So if a patient calls after hours, for instance, about a lab result or a refill, how does that message get relayed? And then what happens next? What happens first thing in the morning when somebody comes in and calls the patient back? I know for a lot of practices, it's leaving post-it notes or creating callback lists, some notes in the EMR, which is totally great. And I think those are all valid solutions. And you're going to need to decide what works best for your business. But the difficult thing about these messages is that chances are you don't have visibility into them. What do I mean by visibility? As a practice manager, you want to be sure that you can promote accountability, meaning you want to have a tool that lets you look at all of your digital communication in an organized fashion, that gives you a built-in record for everything that's going on. And that'll prevent patients from slipping through the cracks. You'll know if a patient wasn't responded to or if they were provided misinformation. You do not have that benefit if your nurses are texting patients on behalf of their doctor from their personal cell phones. Getting back to patients faster. Mobile apps will let you communicate with each other while you're on the move in or out of the office, and that can be huge for answering quick questions, no matter where you are, whether it's to patients or to each other. So compare this to trying to call back a patient, getting their voicemail, waiting for a call back, and then looping in your staff member in person. So inefficient, whereas if you have something that ties it all together, it'll make it a lot easier. Keeping team members in the loop goes towards accountability, but also just more team effectiveness. When one team member is out of the office, whether it's a physician or if somebody's on a different shift, maybe somebody's overwhelmed with messages, you really need your internal notes and your internal communication to be tied into your patient communication so that other team members know what's going on, or so you can share the workload and help each other respond. Medical practice leadership is a team sport. I've never seen anybody master it completely by themselves. So having a tool that lets you do that is really key. Think a little bit about what drives employee happiness. I think that 300 phone calls a day for one person to answer and doing a ton of callbacks is probably going to wear somebody out after quite some time. And the bottom line is that people will get frustrated when they're staying late doing something manually that they don't think they should be doing, or that there's a better way. Don't you agree? If you have a better way to do something, then wouldn't you do it? They'll be more engaged if they have more time to build connections with patients. And so in that sense, the last thing I think is think about the gaps in communication. I think I gave you a couple questions that you could consider. Analytics can help you see things that you really couldn't see before. And you might be surprised about the communication gaps that surface when you're actually tracking these things and looking into them. And most importantly here is that your patients will see the difference. So beyond all the other improvements you'll see with efficient communication, the most important is that your patients will feel taken care of, not only because your team is on the same page, but because you have more time to devote to patients in the office. If you can give your staff tools that handle communication more quickly and easily, you'll make them happier. And the happier staff creates better experience for patients. And that helps you set yourself apart as a practice that cares about their patients, because then the moment they leave you those awesome reviews. And I think that's it for me. Back to you, Erica.
Awesome. Thank you, Lawrence. That was a really helpful overview of the digital foundation that you need to communicate with patients. And I think maybe not for the people that join this webinar, but for other folks, it can be hard to know what happens behind the scenes to support patients and to support a practice. So I think operationalizing and streamlining your business is super important and a really possible way to improve your business. So with that, we've reached the end of our presentation today. I know I've enjoyed spending the last hour with you all and definitely learning more about some communication strategies and improvement strategies for my clients. So a big thank you to Lawrence for joining me as well. Before we move on to the Q&A of the webinar, I want to direct you to a couple different websites and additional resources. The first is a neat doctor.com tool that lets you analyze your web presence for the things we discussed today and identify any gaps that you might have in your reputation, like sites with very few or negative reviews or incorrect data. And that's our scan. The second is where you can request a free one-on-one discussion with a practice consultant who can talk about anything we went through today in greater detail and help you apply that to you and your office. That would be our demo, of course. And then the last is a button here where you can reach out to Klara for further communication on, clarification on patient and internal communications and streamlining things for your practice. So these will all be, and all of the slides will be sent to everybody who joined and who signed up for this webinar. So if you ever need to access these links, you'll get this in your email. And I hope everybody gets in touch if you have any sort of questions about how we can help you improve your business. Before we do that, I'm just going to open the floor to any questions that you might have immediately that we can help answer in the next 15 or so minutes. One thing I did want to touch on, I see a comment from Morgan about 20 minutes ago that most patient complaints are about customer service issues outside of the care received. Totally agree, to be honest with you. I think a lot of the providers that join chats like this and want to work with companies like Doctor.com and Klara really care about their business and really care about the care that they provide to patients. Customer service is a huge element of any business, whether it's a restaurant, a movie theater, a doctor's office. It's very important to treat customers and patients with respect and to treat people the way you'd like to be treated in any sort of environment. So I very much agree with what you said. I think that there's a way to respond to reviews and there's a way to communicate with your patients respectfully about customer service and about the care that they received more broadly than the actual care that they received with the doctor or the nurse practitioner or the dentist. And I think definitely as well, talking about communication and strategies to improve the business operations of your practice will also impact customer service, right? Because we're not talking about phone tag, we're not talking about missed calls, we're talking about easy ways to get in touch with your patients. So even if the interaction aside, it's very important to have channels that make it super simple. And like you just said, 70% of patients agree that good communication is an integral part of the 5-star experience. We obviously could not agree more.
There's also a really interesting thing that you said, Erica, which I liked, was going on the offense as opposed to playing defense. I love that your product integrates that right from the start, sort of syndicating those reviews and making sure that positive patient reviews are the ones that stay ahead. And I think it ties back exactly to what we talk about in terms of a lot of practices that I talk to say, we have really great patient experience, and those practices that are sort of forward-looking continue to think about how to innovate on their patient experience as opposed to just doing it once they've already received a complaint. I see there's a question here. Are you saying that there's a device that will generate text messages or is connected to our EMR? How do we capitalize on the text method within our practice?
So
really great.
Oh, you go ahead, Lawrence.
Do you want to start, Erica?
Sure. Sorry for chiming in. So I did mention a little bit about the ways that you can text patients a link to leave your review. At Doctor.com, we do not directly integrate with your EMR system at this time, but instead we can just either use a patient phone number or an email address that you can just quickly collect or pull from the directory you might have up. But we do not directly link into your scheduling system or your EMR. So that's why when I said appointment requests, we are able to generate the message that you would receive. It doesn't directly go into your booking system. Once you have that confirmed that in whatever system you use, frankly, a lot of my clients are still on paper. Obviously, a lot of offices are more modernized with EMR systems. There is a way, of course, that you can use the two seamlessly. They just don't directly integrate. But Lawrence, if you have a different method for the actual communication, take it away.
Yeah, so the beauty of Klara is, and if this is a Klara related question, so there are systems like Klara that are integrated with your EMR. And the way that I try to encourage clients to think about it in terms of your second question, Kimberly, how do we capitalize on the text method within our practice? Think about anything that patients would normally need to call the office for or leave a voice message and try to find a solution about, that allows patients to do that using text messaging. You want to make sure that that is HIPAA compliant and secure, and you want to make sure that you have the necessary workflow integrations to do that. But in the case of Klara, Klara is integrated with several EMRs, and Klara really functions, even if it's not integrated with your EMR, functions as a communication system because it's integrated with your phone lines and your website. So we're kind of pulling together all the communication elements of your practice into one platform as opposed to having it spread out across several. I hope that answers your question. Yes, Jordan, you can. Great. So once again, I guess, Jordan, to expand on your question, the objective is, and the way it looks on practice websites, is a dynamic chat tool. And so thinking about the solution in practice is that because it's integrated with your phone lines and because it's integrated with your website, your staff is needing to remember, oh, I need to check whether I got an email about that web form, and oh, let me run over to the voicemail system. All of that now flows into one place. And that's really the goal, to help your team manage their tasks and their communication more effectively.
Awesome. Okay, great. If anybody else has any questions, feel free to drop them in the chat. We'll stick around for a few more minutes. I've got the recap up on the screen. Just real quick, want to summarize here some of the objectives that we had from this webinar that we hope you can take away for how you can get your online presence in tip-top shape, harness the power of patient reviews, enable a modern booking experience, provide a convenient way for patients to engage with your practice, and streamline your internal communication. And I think if everybody was listening during the last hour, all of these will both make it easier for patients to find you online, to know that they want to be confident that you're the provider they want to see, to then make it super simple for them to book that appointment to actually get through the door. And if they had any questions or needed to communicate with your practice, they can do so in a very, very simple way that'll both be easy for them to use and for your staff to interact with. So a lot of takeaways here. Again, these slides will be emailed to you. You'll also get links in that follow-up message directing you to some additional resources from doctor.com and Klara. If everybody feels good and feels like they really understood the points today, I'm super happy. Again, thank you so much for joining us. Thank you to Lorenz and Klara team for joining us in this webinar. Really exciting for us to continue these initiatives internally. And I really hope that all of our guests had a good time as well.
Thank you, everyone. It was awesome. I hope you enjoyed it.